Hi, everybody. This is Norm Dubay, and this is the Copa Roundup for the week ending June 24th, Friday, June 24th. I need to apologize to a couple of people, my good friend Ken Mack and my other good friend Patrick McNamara. Yes, I do have two good friends. I had a little bit of a health issue, so I missed the last couple of weeks, and they were slated to be on. So we're hoping that we get them on sometime in the future. But today, we have a special guest on who's going to be talking about PTSD Awareness Month, which is June. I don't think Ken or Pat, after missing the Copa Roundup the last couple of weeks, have PTSD, but it's going to be great to learn a little bit more about it. We've got Anthony Heigl, who is a psychology intern with us under Dr. McBride, and he's over at the East Valley Clinic. But Anthony, how are you doing?
Hi, thank you for having me today, and thanks for asking. I'm doing well. How about yourself?
I am good. It just seems like things tend to go wrong once you get past your 50s, and I had a few things go wrong with me, but turns out it was not that much at all. So it's good to see you and good to see that you're doing well. So, hey, Anthony, before we get started about talking about PTSD, can you tell me a little bit about you and how you came to Copa Health? I know that you're a psychology intern right now, but how you learned about the organization and where your education was.
All right, well, I'm very excited to be a part of this conversation as this is an incredibly important topic of discussion. So my name is Anthony Heigl. I am in my final year of academic studies and clinical training as a doctoral student from Medaille University, and this is back in upstate New York, specifically Buffalo, New York. So you might have heard about us on the national news every once in a while during winter.
Yeah, Buffalo is a little bit famous, or should I say infamous, for the snow that they get. And I know in that region up there, the most beautiful place in the world when it freezes over is Niagara Falls. So I hope that you got to see that when you were spending time up there.
Definitely have. So I come here to Arizona working with Copa Health as a doctoral intern. So I've had the privilege this past year to really further develop and grow as a budding early psychologist. I've worked alongside so many compassionate individuals here at Copa and really have just come to appreciate, just the integrated healthcare system that we have here. So yeah, as a doctoral intern, I practice as one of the providers who is a part of the Health Service Psychology Training Program.
Well, it is a great program. I've been so proud of Dr. Medine and the way that she launched this program a couple years back and its success and how it's doing. So welcome. I'm so glad that you're here. Tell us a little bit about PTSD and how it's involved in your counseling. And even though I think I know what PTSD stands for, maybe you could just say that for everybody who might not know.
Of course. So PTSD is post-traumatic stress disorder, and it is something that is always on the back of my mind whenever I'm working with a new individual. So I have to be very cognizant and mindful of any symptoms that may be related to a traumatic event or experience. This basically, for me, it will look like, or any other clinicians rather, we look for the frequency, the intensity, the duration, and the onset of those symptoms. We want to really better understand the individual and identify, whether these symptoms are consistent with the mental disorder known as PTSD. So in addition to that, when providing psychological services, I have found it incredibly advantageous overall to the overall treatment outcome when we incorporate clinical practices that are trauma-informed. And so trauma-informed practices, it often incorporates the screening of trauma at the onset of treatment, continually reassessing throughout the course of treatment, implementing evidence-based practices, really trauma-informed interventions, and also ensuring we're creating a safe, supportive environment that is also nurturing and just going to help empower the individual that we're working with.
Anthony, sometimes I share a little bit too much about my personal life, but my wife happens to be a World War I and World War II buff. She really loves reading books, watching documentaries on especially World War II. And PTSD used to be known as being something that happened in war. It used to be called being shell-shocked many years ago. But what other things can trigger PTSD, and how does an individual recognize that this may be a problem?
So that's a great question, Norm. So with the rates of PTSD, they are significantly higher among veterans and others whose vocation, significantly increases the risk of traumatic exposure. So, for example, this can, police officers, firefighters, emergency medical personnel. However, PTSD can occur at any age, and it does not discriminate. So individuals, they either will have directly experienced, they may have witnessed in person, or they might have learned that a close family member or someone very important and close in their life, they have experienced actual or threatened death, sexual violence, or serious injury. So oftentimes, we hear quite commonly about PTSD in war veterans, and there is an abundance amount of evidence. We have, the VA is very effective healthcare settings to treat. And in addition, I think it's important to have these conversations to help just further educate that PTSD is not exclusive to war veterans. So I get from what we know, PTSD, basically it is, can occur from natural disasters like earthquakes, hurricanes, torture, war, terrorist attacks, accidents. So things like plane crashes, car crashes, emergency worker or personnel trauma exposure, working like in the emergency unit, some very, very traumatic things, and having that to be, your day-to-day life. Some other examples, and this is not an exhaustive list, but just some other examples to exemplify is like people who have experienced crime or been a victim of crime, child abuse, domestic abuse, rape and sexual assault, and life-threatening illnesses. So again, this is not an exhaustive list, but just more information that helps to better understand that this is it. It definitely includes veterans and also anybody who might have experienced any of these things.
Yeah, when you're talking about that, I mean, it's kind of right there in the description or the title of it. Traumatic. If it's a traumatic experience, it probably could trigger PTSD, and so that's good to know. But as a non-medical person, I'm not a medical person. I hang out with a lot of them. I have a lot of good friends who are doctors, psychologists, psychiatrists, medical doctors. But as a layperson, how do I recognize post-traumatic stress disorder in somebody, and how can I help them, or how can I seek out help?
So that's a great question as well. It can look very differently from person to person. However, having said that, there are usually key symptoms to look for. So this might look like a person having very vivid and distressing memories, flashbacks. They might at times kind of seem like they are checked out or not quite there anymore. And so that might be a moment in which they are, just dissociating from the reality of where they're at in that moment to protect themselves. And so there are different symptoms. There are physiological responses. A person can notice a very increased heart rate. They can notice, just feeling like they are going to have a panic attack. Their breathing might be a little bit more shallow, or they might start to hyperventilate. And so noticing any physiological responses that they're having, they may present as very depressed, or they might seem, just very detached from social outings. If they were once a social person, they might not want to be around other people anymore, and they might be more avoidant of that setting if it's particular to, just kind of re-traumatizing or triggering PTSD. So yeah, individuals may, just notice in, their loved ones, friends, whoever it may be, they might notice that that person is more irritable. They're having more frequent angry outbursts, and this might be without any, nothing provoking them essentially, and it just is happening out of the blue. It might seem these individuals might be more impulsive, making decisions and rather acting on things that they once wouldn't have done. They might be more self-destructive with their behaviors. They can have concentration difficulties, sleep difficulties. I mean, so there's a long list of symptoms that we'll look for. And so that's why we always encourage talking with your doctor seeking out that mental health evaluation to, truly parse out whether this is, PTSD, or it could be symptoms that might be leading to PTSD. And so really getting a comprehensive evaluation. But having said all that, I think it's important just to note that this is going to cause clinically significant distress. And what that means is this is going to affect their social, their interpersonal relationships. This is going to affect usually their jobs, their ability to function, just on a daily basis. And so these changes are going to be quite notable, quite significant. And it, although there still is a heavy stigma and it still is an invisible illness, although we're talking about it more as evidenced by today, there still is that stigma that exists out there. So really just normalizing, having these conversations, and also approaching it from a very supportive and non-judgmental manner, letting that person know that you're concerned, you care about them. And this is why that you might be bringing this to their attention, or just naming some of these symptoms or things that you've noticed, because it's coming from a good, caring place.
I know we didn't talk about this earlier, but I'm just going to throw it out there. I often think I know the answers to things, whether it's a problem with my car or what my wife wants for her birthday, but I always find it better to check with somebody who really knows. Does PTSD necessarily present itself shortly after a traumatic event, or can it happen anytime after a traumatic event?
So that's an excellent question. So thank you for asking that. So what we do know is, with regards to PTSD, we'll use the DSM-5, which is Diagnostic and Statistical Manual. And so this helps to, diagnose based on symptoms that are presented. And symptoms will typically begin within the first 3 months after that trauma or that traumatic experience. There may be a delay of months. It can even be a delay of years sometimes before that criteria of the diagnosis is fully met. So I think that's important to note, because it might not just happen right away. This can take months or years to develop over time. And that's why I always, I encourage, whenever talking about this topic, just to, ensure having these conversations with a medical provider or a mental health provider to truly, I guess, rule out what these symptoms might be, correlated with. And if you notice any symptoms that are consistent with PTSD, or you experience a traumatic event, then definitely having that conversation with someone in the healthcare field. But yeah, having said that usually within the first 3 months, that is the typical trajectory of when those symptoms will usually begin.
Yeah, that's a great answer. And I really appreciate all the information. You really seem to understand and care about what you're doing. So thank you so much for being here and doing what you're doing.
Well, thank you. It's been a privilege really working alongside so many just compassionate individuals. And I think trauma-informed practice, especially with the population that we serve, it's crucial. I think nowadays it is often overlooked how common trauma can be. And so just, continuing to have these discussions, and I thank you for doing what you're doing, and just, continuing to put that word out there, and having people like me kind of, use a platform like this. So thank you.
Well, maybe we'll get to have you back again sometime. And, and by that time, maybe I'll be calling you Dr. Heigl, but I really appreciate you being on here, your expertise, and I think it's going to help a lot of people. So you take care, and we will see you soon.
Excellent. Well, thank you so much. Take good care now.
Okay. Hey, everybody, that is our Copa Roundup for this week, the last Friday in June. I know, it's just amazing. We hit the summer solstice, the longest day of the year. And for some odd reason, even though it's going to get really hot, that always makes me feel better, because I know the days are getting shorter and we're going to eventually head into cooler weather. Next week, July 1st, we are going to have our wonderful CEO, Dr. Sharna Jaffe-Piper, on, giving us a little message about Independence Day, and just sort of a feel for how she wants everybody to enjoy their summer. But until then, everybody, stay safe, take care of yourself, do healthy things, and especially this time of year, take care of yourself. If you're going outside, it's hot out there. Make sure that you're hydrated. If you have animals, make sure that you don't have them out on hot pavement right in the middle of the heat of the day. And just remember to remind other people to take care of themselves too. Sometimes I think people feel alone and they just want to get out and they forget that they need to be taking care of themselves. So we will see you all next week again, July 1st. Until then, everybody, like I said, take care and have a great summer.